Thank you. We've got 11 people on the call right now. I think there are 20 people on this committee, so we're about a little over half. We might have some decisions to make today.
Sorry, we need 12 members to be a quorum.
A
So
quorum. Okay.
5 or 6 right now. So just so you're aware.
Okay. Yep, that's fine. Yeah, we've got one thing that we will want to talk about, and Steven's going to bring that up a little bit later. I just wanted to get us moving here because we're at time. And we've got some new folks on the call, and I want to make sure that we get introductions this morning. And I've got a couple of items before I kind of launch into my part of the presentation. So before we begin, I want to acknowledge where we're gathered on the traditional and unceded territory of Lummi, Nooksack, Samish, and Semiahmoo people who've cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. I'm gonna just go ahead and just for now, Jill, if you can take the agenda down just for a moment. I want to make sure that just so we can see each other a little bit more easily. We've got 13 people on the call now. I just want to go through and have us introduce ourselves. We've got some new folks. A lot of us are new here in this meeting, so I just want to make sure that we all know each other. I'm just gonna call on people real quick, and if you can just introduce yourself and your affiliation, that'd be helpful. Dean White, do you want to start?
Sure. Dean White, I'm Special Projects Manager in the Health and Community Services Department, and I'm standing in for Melora Christensen.
Thanks. Good morning, Dean. Arlene?
Yes, I'm supervising interns who are getting ready for a career in counseling. And I found that work very interesting and wonderful for me at this stage.
Thanks, Arlene. Good morning. Stephen Gockley?
I'm Stephen Gockley. I'm co-chair with Dan of the Behavioral Health Committee. I'm on the Justice Project Planning Team and on the Health Department's Behavioral Health Advisory Committee.
Thank you. Good morning, Stephen. Dr. Wu?
Morning, everybody. I'm Ying Wu. I'm a retired family physician. We're practicing in this community since 1996. I'm also an intern at the Chuck Nutt Health Foundation, and I'm also a commissioner on the Incarceration Prevention and Reduction Task Force.
Thank you. Good morning, Doctor.
Oh, wait a minute. Sorry, that's not what I meant. I'm a commissioner on the Whatcom Racial Equity Commission.
Okay. We all have a lot of jobs. Stephen Traff.
I'm a supervisor with U.S. Customs and Border Protection. I work on a lot of our resiliency and public outreach efforts.
Thanks. Good morning, Stephen. Welcome. Jill Nixon.
Good morning, everyone. My name is Jill Nixon. I'm a legislative coordinator for the Whatcom County Council Office and staff to the task force and its committees. Thank you.
Thanks. Good morning, Jill. Mike Hilly.
Yeah, good morning. Mike Hilly, manager for the Emergency Medical Services section for the county. Good morning.
Morning, Mike. Danny Carroll.
Morning, everyone. Sorry, I'm in a professional development day. So if you see things going on behind me, I am the Bachelor of Social Work program director and faculty at Whatcom Community College, raising up our next generation of social work practitioners for Whatcom County.
Morning, Danny. Thanks for joining today. Lieutenant Murphy.
Hi there, Claudia Murphy, Bellingham Police Department. I'm sitting in for Kyle Nelson today.
Thanks, Lieutenant. Thanks for joining us. We also have a few guests in the attendee room: Hannah Fisk, Julia Garrett, and Shannon Prescott. We'll have an opportunity for some discussion later for the attendees. I wanted to get into the agenda. We've got a few things to cover, and I'm going to tag team this with Stephen Gockley to make sure that we cover everything here for the behavioral health group this morning. So thanks for introductions this morning. I wanted to provide some preliminary information here. We continue to battle a fentanyl crisis in our community. We have been successful with some interdictions upstream when it comes to the flow and supply of fentanyl that comes into Bellingham and Whatcom County. There's still a lot of way to go with that. I did want to provide just a brief update from Friday. There was a ribbon cutting ceremony at 2030 Division Street for the mobile medical units from Digwalich Clinic, which is the Swinomish tribe's contribution for treatment for methadone and Suboxone treatment that can provide treatment for up to 400 patients per day, which basically doubles the supply of treatment in our community. And it was an honor to be a part of that ceremony, to have the county executive, the mayor, and tribal elders from not just Swinomish, but also Lummi and Nooksack nations come and talk about the same struggles that they're going through, that we're going through, and that we are concentrating this effort for treatment at that facility. So it was a great ceremony, well attended by the sheriff, police chief, and others. So I just want to give you all that update. Jill, if you can go ahead and let's see, I think the document that I would like to have on the screen is the task force's the implementation plan, if possible.
You want me to share the entire implementation plan?
Yeah, I want that one pager that has the there we go. There we go. Yep, that's the one. And I
This
want
right
to
here?
yep.
Okay.
And I go to goal 3, if we could show that. So I just want to make the group aware of what we're being tasked with. So this is a process that the task force went through to determine what committees would take on what tasks. And goal 3 is the higher level task that the Behavioral Health Committee has been asked to address. And I'll just read it real quick here: strengthen and evaluate diversion programs for justice involved individuals with behavioral health and substance use disorders, focusing on improving outcomes, reducing recidivism, and providing alternatives to incarceration. Now, that's a mouthful. What that means is that what we've come away with is that we are wanting to focus in on re-entry services, which have been lacking in this community for quite some time. And what I mean by that, re-entry is basically people coming out of our jail system, and to some degree DOC, the Department of Corrections, and they're lacking the ability to land a good job. And so we've had presenters here in this room. Lisa Marks from a carpenters union comes to mind, who are trying to help people get good jobs within trades in that instance. And when I say good jobs, I mean these are well-paying jobs that people can afford to live in Bellingham. They can readjust their lives and move forward in a way that's meaningful to them and their families. And so we've taken on re-entry services, and largely that means vocational in nature, but also it means housing. It means making sure that people get their basic needs met when it comes to, getting nutritional food, things like that. So that's been kind of the thrust of what we've been discussing here. And I just want to put that out to the committee that reentry has kind of been prioritized, not kind of, but it has been prioritized here for our work plan going into 2025. And Stephen's going to talk, Gockley's going to talk a little bit about kind of how we're going to go through the work plans and what the expectations of the committee would be. And that's largely going to be um, fact checking, ground truthing, giving feedback, all the things that um, the broader committee can do. And we're going to be looking towards having smaller work groups um, work on these issues. So reentry is kind of the top one. And then just for the benefit of the committee, I'm going to head up a second work group, and that's going to focus in on recommendations for Division Street. So 2030 Division is where the work center is at, and where Deagualich and Andeacon Center for the Crisis Stabilization Center is at. So we're going to work on a couple of things throughout 2025, but I just wanted to provide that overview for you all, and for you for especially new members here, to see that these are the recommendations from the Incarceration Prevention and Reduction Task Force. And there's a couple of acronyms in here just so I can provide some context. JPOP is the Justice Project oversight folks, and that is for the new jail facility at La Bounty. And that's a whole other giant project. And they've been tasked with some fairly big programmatic stuff going into 2025 and 2026 and beyond. And then there's L&J, that's the Legal and Justice Committee. And they are our partners on the task force. And at the next meeting in March, that'll be the joint meeting between Legal and Justice and Behavioral Health. Because there's so much overlap between the two committees, we meet 4 times a year just to try to figure out what those connections can look like. So I'm just gonna pause real quick and see if folks have questions before we transition into Stephen's part of the presentation. Dr. Wu, go ahead.
I just have a question about the distinction between 3 and 4. You're talking about reentry, but it looks like 4 is actually reentry and is not on the Behavioral Health Committee's list of topics to work on. And 3 looks more like diversion in this plan. So if you can just clarify that for us.
Yeah, so we are taking on reentry services. Thanks, Dr. Wu, for asking that question. We are taking on reentry as part of a broader diversion interpretation of diversion programs. And so I should clarify just a little bit here. So Bellingham is setting up, just for example, one example, Bellingham is setting up a community court that will start here within probably a month or two. And we have, as part of that, prosecutorial diversion programs, or PDPs, that we need to get set up and implemented. And part of that process means that via a judicial order, sorry, that's a hard word to say, the judge might say, you need to go into some kind of vocational readiness program, or get a job, or whatever the judge says, and we need to have that set up. And we just simply do not have those programs up and ready here in a coordinated way. And so there are opportunities here, like WorkSource. They have programs. The resources that runs the Restore, they've got a program that provides job training for folks largely with disabilities in their store and in their demo crews. And so Stephen and I have met with them, to discuss what that looks like in terms of getting them involved in the work that we're doing here. And then separately, I met with one large trades contractor and then one smaller one to discuss the realities of trying to get people into the work that we're into the workforce, basically. So that's kind of the background on that. Dr. Wu, does that provide some context for you? Okay. Yeah, sorry, don't mean to be confusing. That's and then the other part of number 3 is that we're already doing the work within the LEAD program. So that's law enforcement assisted diversion program, and then the GRACE program. Both of those are within the response division of the Whatcom County Health Department. And so there's work already being done within that. And I see integration potentials between those programs and then just broader reentry services. But we're trying to get reentry off the ground as something that that behavioral health can work towards. So Jill, if you can take that down now, if you thank you. Okay, so I hope that wasn't too confusing. And I think that's the end of my part of the program here this morning. Stephen, did you want to take it from here?
Yeah, thanks, Dan. Let me pick up a couple of loose threads before we move forward. Dr. Wu, thank you very much for pointing that out, the distinction between item number 3 and number 4. This may be an old chart. What I can tell you is that Dan and I have had extended conversations on multiple occasions with task force co-chair, county council chair Barry Buchanan, who chairs our steering committee, and others that have formed some consensus that this is the venue to talk about reentry services. And the assignment on that chart was to the Justice Project Oversight Group, which is a relatively newly created body. They've had 2 or 3 meetings. They are not experts in many of the fields and don't have the history of collaboration and exploration that this committee has. So I think there's a consensus that they might want to talk about reentry and diversion also, but this is really one of the homes for that. So I think, and I'll get into this in a little bit, diversion is a little less in our wheelhouse and reentry much more in our wheelhouse. So that will be where Dan and I are suggesting we start focusing some of our action planning and study work to develop some recommendations for reentry. Yes, go ahead, Dr. Wu.
Yeah, so just to clarify, based on what you just said, it looks like in that assignments box that 3, diversion, is in our box and 4 is not, which is reentry.
It
So
does
I'm
look.
wondering, are those flipped by accident, or should 4 be added in?
I'm going to say 4 should be added in. And I may have sent Jill an earlier draft of that chart. That is not our chart. That's from Peter Frazier, one of the co-chairs of the task force. And I think I've seen a version that has reentry and diversion both in item 3. So I apologize for the clarity, lack of clarity, and just wanted to be clear about what Dan and I and other leaders of the task force have talked about in terms of our assignment and the role of reentry in those. Danny, you had your hand up.
No, I was just gonna say it seems like those two go hand in hand, like you can't separate those two things. So I'm glad you brought that clarity. So you answered my question.
They do go hand in hand, but I'm gonna try to add a little more clarity by saying I do think you can separate them. And the diversion, as Dan indicated, usually starts and may end with a prosecutorial discretionary decision. And I'll welcome Maya weighing in on this. There's a lot of discussion on whether you're talking about pre-charge diversions or after booking diversions, but all of those have some involvement with entry or sidetracking from the criminal legal process. Reentry we see as more the end of the process, where you're coming out of either a period in jail or a treatment program and some other diversionary activity, and you're reentering the community. And as things stand now, there's a cliff, so to speak, where there's not very coordinated, there's not very comprehensive support for an individual to go from life circumstances that were involved in their entry into the criminal legal system uh, into a more constructive, stable, productive, healthier kind of life in the community that keeps them from looping through the criminal legal system. So we've made some good progress in the last year and a half or two with some, I'm going to call it pre-reentry preparation services in the jail. We now have several staff contracted through Lifeline Services, and Dean can add detail there if he wants, to prepare people for reentry into a stable life in the community. But I think what we're seeing in these conversations and in Dan's and my thinking is that our focus on reentry is that community-based set of services that will pick up people coming out of jail or coming out of programs and keep them solid, keep them established, help them keep growing and developing. And that is less well established, less comprehensive by a long shot than what they're working on in the jail. So I think I see us as part of the treatment and support services system that we're trying to build as part of the ordinance and the implementation plan. And so we would pick up and obviously have to dovetail with the reentry preparation services in the jail, but carry forward in a big way those kinds of stabilizations. So the other loose thread I want to pick up from Dan is I want to give the committee a little context, and you could see from the many boxes on the chart that Dan had up on the screen. We're not the only ones talking about this. The task force is talking about this. The executive branch has been charged with implementing the 15 projects on the implementation plan, and they are doing that work somewhat in collaboration with others, somewhat not. The Health and Community Services Department of the county, and in particular the Response Services Division of the department, are our main managers of contracts for all behavioral health services for the most part, including those in the jail, including Lead and Grace. And the JPOP is a more citizen-based organization trying to get its feet on the ground, trying to wrap its head around some of the complexity of those 15 projects and some of the community-based issues. There are a lot of conversations going on around this. We are one part of that. I'm going to be forward enough to say I think we are the lead part on that for some of the behavioral health thinking, creative thinking. But we're not the only ones. And the coordination amongst those groups in my humble opinion, is lacking a little bit with the channels of communication, the coordination of conversations could be better, and I hope that will be one of the things we can promote out of our work over the coming year and beyond. So there's a lot of interest, a lot of activity around some of these things. And we're gonna, number one, try to stay in our lane amongst all those conversations because they can get pretty confusing. And number two, we're gonna try to reach out and communicate with others who have overlapping kinds of responsibilities and interests. Let me just say one other thing, Dr. Wu, and then I'll get to you. The other thing is, as Dan indicated, we have quarterly meetings with the Legal and Justice Committee because it became clear that there was so much overlap between behavioral health interests and the process in the criminal legal system that we needed to talk to each other on a regular basis and coordinate. And I'm going to go back to Danny's earlier question. In a sense, diversion programs triggered by the prosecutor's office, to me, logically lie within the domain of the Legal and Justice Committee, but they feed into a lot of the services that we have traditionally monitored, advocated for, overseen. And so that's a place where I would suggest that we give the lead to the Legal and Justice Committee and the prosecutor's office on identifying some of the scope of what they want to work on for diversion. And we probably follow along with them and coordinate with them and see how we can help support that. Whereas on reentry, we might take the lead with that, and they might follow along and coordinate with us with the jail-based services and some of the other criminal legal processes like recovery court and so forth, and community court, like Dan mentioned. So I just want to clarify how complex the landscape is right now to try to make real the promises that we made to the electorate when we passed the sales and use tax and adopted the implementation plan. There's a lot to do. It's a multi-year process. What we're trying to do is bite off year one and take a focused look at that work and follow through on the assignment that we've been given, although not completely clearly from the chart that you saw, but as well as we understand it. So Dr. Wu, your question.
This is just a clarification. A minute ago, you mentioned a list of 15 projects.
Yes.
So that is different than the list of 10 that's on this chart. Where is that list of 15 projects and how can we get a copy of it and who owns it?
I'm going to rely on Jill for fact checking here, but I think there is a link on the Incarceration Prevention Reduction Task Force's homepage to the Justice Project, and there's also a Justice Project page. Both of those have a link to an implementation plan that sets out 15 projects. And Jill, have I given the route through the online resources correctly?
Yes, that's correct. The document you want to look for is the Justice Project Implementation Plan.
So anybody who has
Thank
trouble,
you.
yeah, anybody who has trouble navigating to that, who is interested in seeing it, you can contact Jill or you can contact Dan and me, and we'll make sure you get your eyes on a copy of that. So moving on to more concrete details. Those of you who've been on the committee for 6 months or more recall that we've had a couple of somewhat halting conversations given our assignment to come up with an action plan for 2025 work in the behavioral health realm. We didn't really have the focus that we think we have now. So we floated the idea that let's just see what your passions are and who coalesces around an idea that we think is a good idea, and let's explore it and make recommendations about that. So we had, and both of these came from Dr. Wu and his creative mind. We had an idea to do real-time street level drug testing to determine the potency of some of the drugs that are causing so much substance use disorder problems in the treatment agency realm and the criminal legal process. We had a suggestion to explore Homeboy Industries, a model prison reentry program based in Los Angeles that now has tendrils around the country in slightly different forms, some of them in our Northwest Washington region. And we were looking for program models that seemed to pique our interest. Then we got a little more clarity from the task force that and from the executive's office that they were looking more for policy level recommendations rather than specific program models that we wanted to push forward. And so Dan and I have taken a step back. We don't want to reject any of the specifics that we've floated before, but that doesn't seem like the right starting point given the marching orders we've been given. So we want to think about this more at that policy level, more general recommendations, and I'll just underscore that by reminding everybody we are an advisory committee only. We are not an action or a real decision-making implementation committee. We advise the task force. The task force advises the county council. The county council advises the county executive. There are a lot of layers to this. And so it seems most appropriate for us to sort of sketch out a framework that we can move up to the task force. If they adopt it, it goes to county council and the executive, and they start to flesh out the details within that framework that we move forward. So with that sort of new picture of our work in mind, Dan and I were trying to think how best can we start to dig in at the appropriate level to some of those tasks. And we know that, I mean, Dr. Wu and I have the luxury of being retired, even though we're pretty busy. Not all of you, in fact, most of you do not. So you have full-time jobs. We tremendously appreciate the amount of time you contribute to this committee and our discussions, but to add on some more work is maybe too big an ask. Certainly that's an individual decision on your part. We thought the best way to do this was to form a couple of work groups that dealt with some of the tasks on that chart that Dan had up, even if they weren't in the top 3 or 4, and let those work groups dig into those. These are out of our monthly meeting work. So it's an added responsibility, and not everybody can do that. Not everybody will be interested in the topics. But I think that'll be an easier process for us to actually get into some of the subject matter, to have debates and research matters, and to formulate some plausible recommendations. Our vision is that we would form a couple of those. Dan mentioned that he would like to convene a group working on the idea of what services should be on the Division Street campus where the Ann Deacon Center and the Dijwali Clinic are now situated. There are some other facilities possibilities there, and a little footprint in the land available there that could be planned for. And one of those probably is a 23-hour crisis relief center, and so that would be part of what Dan might facilitate conversations and research and recommendations around. I volunteered with Dan and Peter Fraser that I would convene a group that focuses on community-based reentry services, what that might look like, what principles we might be looking for in that. And I want to say that Dan has emphasized some job training possibilities that we've had initial conversations around the community about. But to me, the idea of reentry is a pretty wide open topic. It involves warm handoffs to mental health providers, to substance use disorder treatment providers. It involves transportation, it involves navigation, it involves intensive case management, it involves peer support, and we have a number of community-based peer support activities we could loop into that. It's sort of like a hub and spoke model that that Lead and Grace both work off of. And so I think our level of recommendations will be that reentry services in the community ought to have X, Y, and Z components. We may not delineate exactly what those are. We may give examples of those. But I think we want to be clear that we are strongly endorsing a wide range of supports for people reentering the community that gives them the best chance possible to stabilize their lives. And I'll pause there. I see Maya's hand up and then Arlene. Go ahead, Maya.
Yeah, thanks, Stephen. Um, I mean, I'm glad that there's more conversation about reentry and about diversion. Like I guess I understand the idea of smaller work groups, but there's a lot of people doing the work, and I just want to make sure that the work groups are, I mean, maybe you're trying to work on some bigger. I just don't want you to lose the experts that are in the community doing the work and like their voice being in that. And because if it's you, Stephen, and Peter and Dan Hamill, hi, you guys are great minds, but you're not the people doing the reentry work. So I just want to make sure that, and it makes me nervous that there's not somebody, like we have the people doing it that are not included, and maybe that's by intention, but I don't know.
No, thank you for raising that point. I think one of the charges to the work groups is to make sure you're connecting with and amplifying rather than pushing aside some of that expertise and some of that ongoing work. This all has to fit together. So a reentry work group would be immediately talking to Lifeline, and Hannah Sloan in the jail would be talking to the response services division staff and their contracted agencies who are helping navigate this. But right now, there's a lot of siloing going on in that. There are conversations, and we want to be informed by those conversations. And I want to emphasize, we're not doing that work. We're just making sure that those connections and are maintained and strengthened.
Well, I would suggest that let the work, whatever work groups, all these different work groups, and maybe you already intend to do this, but like, I think our office does actually a lot of reentry, our 3 behavioral health specialists, because we touch all the public defender clients, which are a lot of the people. And we meet regularly with those groups. So maybe just consider, rather than trying to create additional meetings for those people to have to work into their schedule, asking them what meetings already exist, and then if you're permitted to join and sit in on one or something like that, just as a suggestion.
Yeah, I think that's a great idea. I do want to be clear. We've been assigned this job to explore reentry, to make recommendations. So the public defender is way deeper in this than we will be in our discussion. I think that's why the executive is asking for policy level recommendations, not programmatic operational details. But I think we are given a responsibility to make that level of recommendations. They need to be informed by your behavioral health staff and others who know that field closely. So I don't want to substitute for that. I really want to be clear and assuage your concerns. And I want to carry out what we were told to do, which has been a struggle to understand for a couple of months. But I think this is as clear as we've been on this. So there's not a right way, or there's not a set roadmap for this. So I would just invite you to keep giving us feedback like you just did on how best to do this. And we'll try to follow that path and still satisfy the layers of this planning process that are above us. Arlene.
I'm most passionate about the 23-hour crisis clinic.
If I could just interrupt, we're not quite ready to pick our slots yet.
Oh,
I still
what are we doing then?
I want to frame this out a little bit for what these will look like. So I think Dan heard your expression of interest, and you can elaborate on that a little bit later when we get into that, if you don't mind my putting a pause on that. So I think what Dan and I are seeing is, I mentioned that these would be smaller work groups. I'm thinking 3 or 4 people is sort of a workable conversation. They will have a responsibility to branch out into the community. They will have a responsibility to look at best practices around the country. They will have a responsibility to look at what kind of resource intensity is involved in this, to see how practical they might be for us locally. And then out of all of that, someplace down the line, they will come back to the committee with some proposed recommendations. And as I mentioned earlier, a lot of you may not have the bandwidth or the interest to be on a work group and to do that extra out of meeting digging and development. You will be our evaluators, because they will bring back proposed recommendations or their work progress to the whole committee, and that will become a focus of a lot of our work for this coming year. This is a little bit different than the committee has been in the past, when it was more of a free-ranging think tank kind of thing, and an advocate within systems for certain programs, as Dan has mentioned on a couple of occasions. The alternative response team, the co-responders, LEAD, GRACE, Recovery House. A lot of these things have come out of the Behavioral Health Committee. This is, and those, some of them came out of our own initiatives. This will be a little bit different, where we'll be a little more circumscribed while we do that work developing recommendations. But the committee as a whole, whether or not you're involved in a work group, will be the body that we have to pass muster with at a first level, that gives us a thumbs up or a thumbs down, or where we can have broader debates or demand better justifications for some of our recommendations, or answer questions. Did you consider this alternative? And so I think the committee as a whole can serve as a checkpoint and a guide for the work of the work groups. So you can see in item 3 on your agenda, the role of the committee. That, I think that's the way Dan and I are picturing the relationship of the committee to the work groups. And then the committee will feed up what it approves to the task force for its own consideration, and we'll get another fresher take on some of the recommendations we're making. So I think Dan and I see two primary subject matter focuses that are in the top tier of priorities. One is reentry with an open question of how do we coordinate with legal and justice on diversion programs, you know, having that different flavor that I tried to tease out earlier. The other is, you'll notice the number 2 on that chart was coming up with some data points and data systems for the whole span of implementation projects across the criminal legal system and into the community-based treatment and support programs. That is not assigned to us, but clearly that has some relevance to work that we're going to be doing, recommendations that we're going to be making, and to whether or not we can prevent and reduce incarceration. So Dr. Bertie Safford, who is the head of the Information Needs and Data Exchange Committee, Index, within the task force, is also a member of our task force. She couldn't be here this month, but she has offered to convene a work group of anybody interested in looking over behavioral health and reentry related data needs, so that that gets integrated, much like Maya and I were just dialoguing about, so that that gets integrated into larger and many-pronged conversations about creating data systems. And so I think Dan and I are proposing a reentry / diversion work group, a Division Street Crisis Relief Center work group, and maybe a data needs or data systems work group. There could be other work groups. I have complete confidence Dr. Wu will come up with some great ideas that might form, you know, a critical mass of people who want to talk about them, and that's perfectly fine. You know, we'd like to track those. We'd like to hear reports back if there are other work groups, but we're trying to start at the top of the priority list of projects, and so I think that is the overlap between the priority projects and the expertise that our committee and our membership has to work for the coming year on this. Some of this will require some reporting back to the task force, maybe writing parts of the task force's annual reports, maybe reporting to the JPOP so that we're coordinating with their deliberations. I think that kind of organizing role, reporting role might fall in significant part on Dan and me as the co-chairs. So that's why I had that bulleted there. And I've covered the suggested focuses. So I'm going to say I think this has been the result of a lot of thought and discussion that Dan and I and other task force leaders have put into this, because I think it's been hard to get a handle on how exactly do we move into the planning stages, into the concrete development stages of the implementation plan. And this is the best idea we've come up with. I'd like to see us go ahead on this, but also I've really appreciated the questions and the concerns that several of you have already raised, and I'd like to see if there are any other questions or comments or additions, feedback from committee members. And Dan, I guess Dan, I'll start asking if there's anything you want to add to my very, very extended comments here.
No, Steven's the lawyer in the group, so he's, you know, the one who's got that brain. Appreciate you bringing up everything, and of course Maya's an attorney as well. I just want to make sure that Maya, that your questions around current reentry services, that's been addressed. I think Stephen did a pretty good job of just saying like, here's where we were given a task. We want to do like an evaluation. We want to come at it at a policy level. Nothing would be duplicative of what's already going on out there, and we would absolutely consult the folks that are doing the work without having a ton of meetings to to get that information. I think we'd be respectful of people's time, and so I just wanted to address that real quick. I think that Stephen did a good job of encapsulating. I think that this is just it's a direction. It's like a shift in the way that we do the work in this on the task force and in this committee to really come up with like smaller groups of folks to do work on kind of more narrowly focused ideas and concepts. And yeah, it's a change. It's different than what we've done before, and I think it's fine. It's the directive that we've been given from the broader task force, and this was a I don't. It was a broad mandate from a large group of people that have been doing this work for quite some time. So now I just echo everything Stephen said, and welcome any questions. Happy to try to answer anything if people have questions. And then I think we're kind of getting towards time, but not quite. And I'd like to get to people that want to work on these discrete work groups that we've identified here. So happy to answer any questions at this point.
Co-chairs, I've got one attendee with her hand raised, Julia Gret, who is I believe the Village Reach representative. Would you like me to give her speaking privileges?
Yes.
Julia, as soon as you're up, go ahead.
Great. Are you able to hear me?
Yes.
Yep. Good.
Well, thank you for giving me the chance to chime in here. As Jill mentioned, I am the primary contractor with Village Reach, and we're working on developing the evaluation and performance measurement plan for the implementation project. And I think something I heard you talk about that I just wanted to get a little clarity on is the directive around quote unquote policy goals. That's come up in other conversations that I've been a part of. And I really want to make sure that across these different groups, we have a shared understanding of what is meant by policy goal. My concern right now is that different people have different understandings of what a policy goal is. So for example, some folks have defined policy goals as for the implementation plan as, reduced recidivism, increased rates of successive diversion programs. And like those are two of the examples, there are four. And so, when you hear me kind of say, for example, reduction in recidivism is a policy goal, does that align with how you were thinking of policy goals for what you've been discussing, or are we using different terminology?
Well, first of all, thank you for touching on that. All we have heard is from Kayla and Melora, I will say, primarily, that policy level recommendations are what they're seeking. I have been in multiple meetings where we've asked, can you be more specific on what that means? And haven't received any clarity. I can understand from Village Reach's perspective how what you articulated as an example of a policy goal makes complete sense. There's also a policy level kind of recommendation that would be more consistent with the example I offered earlier, saying if we want to do a best practice reentry kind of system, it should have X, Y, and Z components in it. So there's both a a structural and an accountability or outcome measurement kind
Yeah.
of policy goal. And you've touched on one, I touched on another, and I think they both need to be in there. So
Mhm.
I would say I don't see us right away until we deal with some of that structural level recommendation, getting to the outcome measurement kinds of policy goals you articulated. But I think we could get there, or you could point our way there, perhaps.
Yeah, that's helpful. I think part of it is maybe just a naming convention, in terms of, right, them both being labeled policy goals, but they're different elements. And so I totally hear what you're saying in terms of what you're aiming to do, and that makes sense, right? And that would feed into this larger outcome that we're looking at. So maybe that just needs to be rebranded, that larger outcome, rebranded, maybe not as a policy goal. So I'll do some thinking on that, but thank you. That's helpful.
Yeah, and welcome any feedback from you as we go along. And I just want to assure you, I think Dan and I have zero investment in what terminology we use. If somebody wants to change the terms we're calling things, that's great. Other comments or questions for anyone? Dr. Wu.
I just want to say I totally support what Maya said. You know, I have no particular attachment to any of the ideas that I've just thrown out along the way, and I'm certainly not an expert in this area. But I think it makes so much sense to listen to people doing the work, rather than super something from above.
Got it. Thank you. Are you raising your hand again, Dr. Wu? Okay. Your internet connection got a little choppy there for a second, so I wasn't sure if you were back for a second bite. So I want to thank the cautionary commenters on this process. I think this is a work in progress. It's, as Dan said, it's a new approach for us. It's a new kind of assignment. And we're working in fields where, yes, there is work going on, has been work going on, and expertise developed. And I sure would hope that nobody here thinks that there aren't big gaps in this and areas where we don't have expertise or should have fresh eyes looking at. So I think it's how to best combine those two, the experience we have, the knowledge base we have, the personnel who are immersed in some of this work, and the openings that we have for expanding, for creating gap filling services that make existing work even more efficient and more effective. That's really what the challenge is, I think, of this. So if we embrace the cautionary comments and the encouragement to include existing work and existing expertise, are people comfortable with this as a way to start out on this planning process, exploration process? I'm going to take one thumbs up and the rest silence as two thumbs up as enough encouragement that that we can move ahead. And so, Dan, do you want to talk about forming the work groups and you know, seeing who's interested in what?
Yeah, sure. I mean, yeah, so we laid out the three different visions for the work groups. So I don't know, we can start with the reentry and see who's game for being on that. just as a co-chair, I will be on that committee, and I'm happy to work with anyone else who wants to join that committee.
Let me offer one other logistical piece of information that may be relevant. We have absolutely depended on the availability of county staff support. Jill has just been total solid foundation to all the work that the task force has done for the last 9 or 10 years and that this committee has done. A work group is an unofficial body that has advantages. It's not subject to the Open Public Meetings Act. We don't have to record meetings, but it has disadvantages. We don't have the staff support that Jill offers. We don't have the county Zoom account. So probably we're thinking about informal discussions held in person, maybe over coffee or whatever, I don't know. But you know, that has some logistical hurdles to overcome to make it as convenient and as time efficient as possible for those participants in the work groups. But I think that's the nature of how this out of committee meeting progress will have to proceed. So factor that in as you consider your participation in the work group. And remember that if you don't participate in a work group, that's fine. We're gonna want to pick your brain as you react to what the work group brings to you someplace down the road. So Maya.
Can you list the work groups? How many are there and what they're titled, just before I start volunteering for anything?
I'm not sure I'm gonna formalize any titles, but one will focus primarily on reentry and secondarily on diversion. One will focus on the Crisis Relief Center and other Division Street campus programs / facilities, because there's still an interest in what facility needs we might have there. And I think the third is working at the intersection of data issues in our realm and behavioral health treatment and reentry / diversion work and other data work that's going on that Julia referenced and that Bertie Safford coordinates with the index committee and that the executive's office is staffing up a little bit for, that Caleb is developing systems for. So feeding into the whole data conversation that's ramping up.
Okay, so is reentry separated from diversion, or are those being merged in one work group?
I think they would be under the roof of that one work group.
Okay.
I would start with reentry because I don't know where Eric is, the prosecutor and his staff. I don't know where they are. They have not been in conversations that I've been privy to on what they think of as diversion. And I know that the Behavioral Care Center is seen now as a diversion, a prosecutorial diversion program, and that has its own work group. So I don't want to barge into a diversion field that is already underway and has a lot of other players who are not on this committee. So I think we'd look for opportunities to contribute to that, but I think I'm not sure that the developing community-based reentry services is something that is well covered. And so that would be what I would think would be the primary emphasis of that.
Can you tell me where the diversion work group is housed?
I'm afraid I can't.
Okay, thanks. Maybe Jill can let me know offline. Thanks.
Yeah. And you know, some of these are going on outside the task force's domain as well. They're going on in the executive branch. I mean, I don't know. That's why I said the communication could be better, and I hope it gets better, so that we can do the kind of coordination you were advocating with people who are already having some of these conversations. Is that clear enough for the delineation of the work groups? Mike, you have your hand raised. I hope it's both figurative and literal.
Well, it is literal. Yes, thank you. Sorry, I apologize. I'm late for another meeting with the hospital, but I didn't want to run from your work groups without saying goodbye. But as always, I have a big interest in diversion, especially related to EMS and that 23-hour center. So if there's conversations for diversion related to EMS, yes, I'd be glad to be included in that. So, but I want to leave you with that.
Okay, great.
Yeah, thank you.
Anybody else? This is not a time limited offer, so you can mull this over, you can check with your calendar, you can try to weigh between competing interests that you might have. Arlene, we got you on the Division Street treatment work. You're muted, Arlene.
Well, I want to be on it because it's the source of the beginning of it. The beginning of any legal problems start at that level, intervening in crises.
I missed the beginning of that because you were still muted, I think. You're talking about why the Division Street services are so important?
Yeah, it's the source of it all.
Yeah.
The start. And if we can divert people from that, that's the best.
Great. Thank you.
Stephen, Claudia Murphy's got her hand up.
Oh, I'm sorry. Claudia, go ahead. I didn't see you there.
Unfortunately, my mouse is locked, so I literally have to raise my hand old school style. I'm gonna abstain from picking anything because I don't want to pick for Kyle since he's the actual member of this board. So I'll give Kyle a rundown and let him decide which small committee he wants to be on or if that's too much for him.
That's great. Thank you. You know, I don't know if we have a quorum finally or not, but there are a number of committee members missing. So Dan and I will try to put out a summary of this, framing the hope that other people will choose to participate in some of the work groups, and so we'll send that to Kyle also. Claudia, thank you. Dean, thank you for chiming in.
Subject to Melora's approval, I'm interested in the data work group that you're talking about, and particularly given my role now working with Julia on that project.
Yeah, and I know you and Bertie have had numerous conversations on this already, so that would be great. Love to have you. Let us know if Melora pushes back on that. Danny?
Yeah, I will join Dan on the Division Street services.
Great. Thank you very much. Maya?
I'm interested in the reentry work group. Thanks.
Love to have you in that. Thank you. Anybody else with anything right now? Dr. Wu?
I should talk with you about my schedule and I should check with my wife before I say anything.
Fair enough. I should have mentioned those as eligibility criteria. Oh, okay. Dan, do we have anything else to wrap up here?
No, I think that we're at time or a little bit over. Are we an hour and a half or an hour?
Hour and a half.
Hour and a half. I'd like to get people out the door here if we can give them back 25 minutes of their day. No, I think the only thing that we have left, Jill, did you got the roster there for those subcommittees, right? Correct?
I do, yes.
Okay, great. So we'll summarize that and we'll get an email out the door here in the next couple of days to let folks know who's working on what, and we'll begin that process of getting those work groups together. I think the only thing that we would have left is public comment.
We do have a couple of attendees. If you would like to speak to the committee, please virtually raise your hand now. No hands are raised. I don't see anyone in our conference room. Co-chairs, if you have a couple of minutes after the meeting to speak with me, that would be great. Thank you.
Awesome. Okay. I think that we can thank folks for the time today. Really appreciate it. Thanks for Stephen Traff for coming on and joining us today. Love further conversations. Everyone else, thank you for being here. And we will see folks in March at the joint meeting with the legal and justice systems. And we'll have updates in between now and then. And so thank you. And we'll go ahead and adjourn here today. Thank you.